hurricane's coming.
Well, this hurricane has prompted an avalanche of questions. Dr. Lipi Roy is here to dig through them in tonight's installment of Dear Doctor. She is the medical director of COVID isolation and quarantine sites for Housing Works in New York City. Dr. Roy, good evening. Good to see you.
So good to see you, Joshua, as always.
Before we get into questions, let me just ask you, you've been busy with vaccinations for this week or for a little while now. How is it going from your perspective?
Yeah, I mean, you know, I'm fortunate to live in a city that has a very long a health department, a city health department that's been at this for a very long time. It's one of the country, if not the world's best public health systems and public health departments, I should say. So you're seeing images now of, that's me with one of the assistant commissioners, Chris Packett. Those are vaccinators, and those are all from the site, the South Bronx site. I was also at the Lower East Side in Manhattan. So at both of those sites, I think we vaccinated over 800 New Yorkers, New York healthcare workers, as well as elderly and other eligible New Yorkers at both of those sites. So I will say it makes for a long, tiring day, but it's also highly rewarding when so many people are coming up to you, thanking you for the opportunity to get vaccinated. And I remind all of them that they're playing their part in helping us fight the pandemic. But we are facing issues, Joshua, as you know, limited supply of vaccine,
right,
and we're facing an equity problem. There was the New York City Health Department just released data showing that of the people that have been vaccinated, 48% are white, 15% Asian, 15% Latino, and only 11% Black. And yet we know that severe disease and mortality is more affecting people of color. So we need to fix these problems.
Well, with regards to that supply question, that gets us to our first audience question. We'll get to as many as we can in this segment. Let's look at what Dave left in our inbox.
I'm Dave Calhoun from Lebanon, Pennsylvania. Numerous reports say that we don't have enough vaccines. My question is, if the companies are working 24/7 and 7 days a week, how long does it take to make the vaccine? We keep seeing thousands of little bottles on conveyor belts. Is this happening daily, hourly? I received my first shot of Moderna several weeks ago and due my second very shortly. How long before other groups and other categories get the vaccine?
Dave, good question. Dr. Roy, what is the timeline for actually producing the vials of these vaccines?
So Joshua, first let me commend Dave for getting his first dose. I too got my first dose of the Moderna vaccine a few weeks ago. I'm due for my second dose this Tuesday. I will keep you all posted on how I do. Yeah, great question. I too am seeing all those little images of those little vials on those conveyor belts. So my understanding is that the companies are working as fast as they can. The bottleneck is not really there. Although I will point out that there's a quality control aspect, right? I mean, every vial has to be inspected. All of the components in each vial have to be inspected very carefully, and we want that to happen. But it's also important to remember that, you know, these companies, Moderna, Pfizer, they're not just making vaccines for the United States. In order to fight this pandemic, Joshua, we can't just have the U.S. reach herd immunity. We need the globe to reach herd immunity. So I think that's also something important to remember.
And we should also remember that there are some fights in parts of the world, like between the European Union and the UK, now that it pulled out of the EU, in terms of getting vaccines back and forth. That has been a big fight over the last few days. Let's get to our next video. Here's what Lorena wants to know.
Hey Joshua, I'm about to get my second vaccine, and I've been isolated from friends and family since March. I'm terrified and very excited about being able to be among them again and get their hugs, but I am afraid I'm not really clear on whether I need to wait 15 days or 10 days after the vaccine, which in my case is Moderna. And I know I have to wear a mask, and any other information you have about that day of supposed freedom when I can walk out of this isolation and be among humanity again. Thank you.
Thank you, Lorena. Totally understandable, Dr. Roy, that she wants to know how long after you're done being vaccinated can you feel free again?
Yeah, don't we all want that feeling, Joshua, feeling free again, right? So first of all, to Lorena, thank you, Lorena, for doing the right thing in terms of protecting yourself and the rest of the people around you, including your loved ones, by staying isolated. So here's the thing. What we know is that the person who gets vaccinated is protected from getting the disease, a 95% reduction in getting the severe illness. However, we do not know if if you're able to still transmit the virus to others. We've already seen cases where people get the vaccine and yet they test positive. So that means you can still test positive and possibly transmit it to others. That's why even after you get your second dose of the vaccine, it's still so important to wear that mask and to maintain physical distancing until we really have more information, Joshua.
Let's get to one last question. Here's what Jenny wants to know.
Hi, my name is Jenny. My question is about the antibody test. If someone had COVID-19 in the past year and didn't know it, how accurate is the test and how much time needs to pass between having COVID and antibodies showing up that can be tested? Thank you.
Thank you, Jenny. And if I could, Dr. Roy, just expand that. Another viewer asked about COVID testing and these new variants. How do the variants, and we know that viruses mutate, that's how they propagate, how do these variants affect COVID testing, antibody testing, and so on?
Yeah, so let's start with that viewer's question first about the antibody testing. So it can take about 2 to 3 weeks to develop enough antibodies to get detected in an antibody test. So don't get tested too soon. But we also don't know how long these antibodies last or to what degree of immunity they will confer. Because as we know, we've seen a few cases of reinfection. As for the COVID tests, so remember, these COVID tests are testing for coronavirus infection, right? So it's not able to detect or distinguish between the different variants. These COVID tests are detecting the coronavirus, so via either antigen or through PCR or DNA testing. So it can't distinguish between what variant you have.
But and very briefly, just because it's testing for this type of virus rather than every single genetic variant, it should be able to catch various variants because these variants still have the basic same genetic structure, right?
You're absolutely right, and that's why it's actually still important for everyone. I know they're hearing so much about these different variants from different countries. By the way, the U.S. probably has its own variant as well, but we just don't know because of decades of underfunding. We just don't have the same level of genomic sequencing for surveillance the way that the U.K., South Africa do, right? That's why they've been able to detect their own variants. But this is why it's important for everyone to get vaccinated. We need to use whatever tools possible in order to reach that herd immunity so we can protect all of ourselves. Joshua.
Dr. Lipi Roy, we appreciate your help answering questions tonight. Thanks very much.
Good night, Joshua.
The Super Bowl will be missing some of its biggest commercials this year.